The Ohio Police and Fire Pension Fund heard directly from some of its retirees today who say they are frustrated about changes in their health insurance benefits. We thank you for staying with us at 6. I'm Colleen Marshall.
I'm Mike Jackson. For some, the change in benefits means inconveniences, finding new doctors and new hospitals. For others, just trying to navigate through the enrollment has been a challenge.
And here's where things stand. Retired police and firefighters in Ohio less than 2 weeks away from losing their health insurance program. The Ohio Police and Firefighters Pension Fund has no legal obligation to provide insurance, but it's been insuring retirees since the fund was created by state lawmakers in 1965. The deadline to elect coverage plans for 2019 was December 15th. They will get stipends instead.
NBC4's Ted Hart is live at the Pension Fund headquarters tonight with more on the outrage shared by former first responders today. Ted?
For many, it was the process that was so frustrating.
It was basically pull up the screen, close your eyes, and point to one, because was no information that I could find that was beneficial.
Not everybody is happy. We know that.
Board Chairman Timothy Patton said that after a rocky start to the sign-up period, more than 21,000 members are now enrolled. The pension fund is changing from a self-insured group plan to a stipend that allows retirees to buy their own insurance, but only from within the insurers offered through a company called Aon.
Now I have to buy insurance from a company I can't even get a hold of. And when I do get a hold of them, the people I'm talking to don't even know what they're doing.
Health insurance in retirement has long been one of the perks for police and firefighters who are eligible to retire in Ohio as early as age 48. But the pension fund said the health benefit is unsustainable, and now it's just a matter of how to manage the years that it has left.
This change has allowed us to extend the health care solvency from 7 or 8 years out to at least 15 at this point. This choice was made for the benefit of all of our members.
But some retirees are finding that the new insurance offerings don't cover their health care providers. Retired Columbus firefighter Dave Kennedy decided the stipend wasn't worth it.
I bought Blue Cross Blue Shield. I don't need eHealth and I don't need Aon. Thank goodness.
That was Ted Hart reporting. Ted goes on to say the pension fund says about 70% of the retirees under the age of 65, more than 80% are over the age of 65. They've now enrolled. He says that's much better than what they expected.
Yeah, and again, that was Ted reporting. And we do have an update tonight and some good news for at least one retired firefighter. Assistant Fire Chief KARRY ELLIS shared this story with us last night of his health problems. He's in kidney failure. He's working with Ohio State University's Wexner Medical Center for an eventual kidney transplant. But neither his doctor nor any OSU hospitals are covered under these new insurance plans. After our story ran, KARRY was contacted today by his new insurer, Medical Mutual, and that company has now agreed to use its specialty coverage program to pay for his transplant and allow him to keep his doctor.
Other troubling stories from first responders continue to pour into our newsroom and onto our Facebook page. To see them and hear about the changes, just go to NBC4i.com.